2 speakers at a time. And also, measles rubella is close to my heart because when it started in 2001, I was called the measles energizer bunny because I was so enthusiastic. I loved doing it. And I feel like it's such a thing because when I was in 2001, when we started it, there were 450,000 children dying alone of measles alone, more than malaria and more than TB in Africa. And we've reduced measles deaths by, and I'm going to hold that percentage so that James can explain that to you later on. But James going to introduce himself. He is a wonderful human being. He's been dealing with my emails forever and my questions and my phone calls, and has always been really responsive. He's the national director of or manager of measles at International. So, James, if you would start, and then Neha's going to introduce the rest of the panel.
Fantastic. Thank you so much, Jill. As she said, my name is James Noe. I'm the Senior Program Manager for the Measles and Rubella Partnership. I work at National, though I'm based in New Jersey. I help to support our team in various, pretty much every area of our work, whether that's our vaccination campaigns overseas or our domestic advocacy work through the chapter network. I'm kind of have my hands in kind of everything that we do to some way, shape, or form. But I'm really excited to be here today to give you guys some information about what the American Red Cross does as part of the larger Measles and Rubella Partnership. And with that, I'll hand it over to Neha.
Before Neha starts, I'm just going to ask you the question that I asked you earlier before we got on.
Sure.
What did you think you were going to be when you graduated from high school?
So I can honestly say in high school, I did not have an idea of what I wanted to be. I will say once I was in college, I studied urban planning and was planning to go into local government and help design cities. But that all changed when I got back from the U.S. Peace Corps. I was stationed in Bangladesh, which sees just about every disaster known to man. And I experienced a lot of those firsthand. So when I came back, I decided I want to get involved in helping people in disasters. And here I am with the Red Cross.
I love it. I'm also a Peace Corps person, so I totally identify with that. Okay, and then I'd love to introduce you to Neha, who's one of our oldest members for our region in helping start the Measles Rubella regional program. So Neha, would you like to introduce yourself and the others as well?
Sure, thanks, Jill. Hi, everyone. My name is Neha Rane. You'll also see me by my full name, which is Niharika. So I go by either, whichever maybe is easier to pronounce. But I am a biotechnologist over at Hoffman La Roche. I'm also a master's student at Johns Hopkins University. And along with Annalicia, who I'll introduce next, I am the co-director of the local chapter of the Measles and Rubella team. I am based in San Jose, and I'm part of the Northern California coastal region. And so with that said, I'll go ahead and introduce Annalicia. She is a pediatrician on faculty with Stanford University. She's also a co-director of the NCCR Measles and Rubella Partnership for the American Red Cross. But I will also pass it off to her, who I think will give a better introduction of herself than I can ever imagine to do. So Annalicia, if you are ready, do you mind introducing yourself?
Sure, Neha, thank you. So in addition to my work as a pediatrician and with the Red Cross, I'm very involved in humanitarian work, primarily internationally. So I'm also the director of advocacy for a group called Health Tech Without Borders. So I think I'll stop there and pass it back to Neha.
Thanks, Annalicia. We also have Peter George, who will be co-presenting with me in the third segment of this series. He's a third-year pre-med student at UC Davis studying human biology, and he joined the American Red Cross's Measles and Rubella team about a year and a half ago. And he's very passionate about educating youth about infectious diseases, immunology, and vaccine advocacy as well. Peter, is there anything else you want to add on to that bio?
Yeah, you pretty much summed it up. Yeah, I'm Peter. I'm a third-year human biology student at UC Davis. I'm pre-med, so I hope to be a doctor one day. And yeah, I've been with the Red Cross for about, a year and a half. And yeah, I'm really passionate about infectious disease awareness and vaccine advocacy.
Perfect. Thanks, Peter. And I'll be introducing two of our youth vaccine advocates next. So we have Sangwi and Anishka, who are going to be our final presenters. They are very passionate about being youth involved in taking a stand for vaccines, especially at such a young age. But I will pass it off to both of them to maybe give a brief bio of where they go to school and what they plan to do next. So do you mind unmuting yourself, you guys?
Yeah, hello, I'm Song Wei. I'm a current senior at the Harker School, which is in San Jose, California. I'm interested in public health, health policy, specifically looking at the intersection between like policy and health and trying to place health in various different contexts. In college, I'm interested in being pre-med and studying like bio, public health, or psychology. We'll see.
Hi, my name is Anishka. I'm a senior at Basis Independent Silicon Valley, so from San Jose, and I'm going to Johns Hopkins in the fall to study public health, and I'm really passionate about like a lot of different things, infectious diseases, mental health. I love to volunteer, and at my school right now, I'm my Red Cross club's president. So yeah.
Wonderful. Wow, this is so amazing. I'm so grateful to all of you for your willingness to give up your Thursday afternoon to do this. And I'm going to put the two other elders that are on this call were on the panel on the spot by Neha. Would you be willing to tell me what you thought you were going to do when you graduated high school? And Annalicia, what did you think you were going to do when you graduated from high school? And by the way, Annalicia has a beautiful child that she isn't there right now, is she? Unfortunately. Oh, but anyway. So Neha, do you want to go ahead
Sure,
and
yeah, I'll give it a stab. I think for me it was really weird because I think I love biology the second I took my first biology course. And so then I was like, I want to work in bio, and that's what I ended up doing. I specifically wanted to go into bioinformatics. I didn't 100% do that, and that's basically a fancy way of saying, maybe computational biology. I just do microbiology now, so slightly different, but I was, maybe 6 courses away from becoming a bioinformatician. So very in line with what I had imagined in high school, maybe
what
fortunately or unfortunately.
wonderful. And then Annalicia, would you be willing to tell us what you thought you were going to do when you were in high school?
Sure. So I have wanted to be a doctor for a long time, and I do love what I do. I had imagined myself doing something more along the lines of like Doctors Without Borders. I still might do something like that as my career moves forward. But uh, one of my favorite icebreakers is what my dream job would be, which if I didn't go to medical school, I think it would have been really fun to be a photographer or a writer for National Geographic, something like that. But anyway.
I love it. I love it. That's what I would love to do too.
Yeah.
When I grow up. I totally get it. In any case, without any further ado, we'll start with the panel. I think, James, you're first. We put you on the spot first, and please go ahead. That's wonderful. Great.
All right. Again, just want to thank you all for giving me this opportunity to talk to you about the program. I've been working as part of the Measles Rubella Partnership since 2012, so coming up on, I guess, 13 years, 14 years. My math is bad. But anyway, I want to start things off, if we can go to the next slide, with just a short video to give you an idea of the work that the American Red Cross does as part of the larger Measles and Rubella Partnership. So if you can go ahead and show that.
We are working with the Kenya Red Cross to strengthen routine immunization systems at the community level in a couple of targeted areas.
Basically what happens here is you work together with the authorities and they are able to then immunize the children that they have not reached.
We are targeting a couple of different areas where vaccination coverage level is below the level needed. We need to make sure that we're able to protect children in both our urban areas like Nairobi or our rural settings. These volunteers come with a built-in level of trust that makes the message that they are providing to the community more easily accepted.
When I help those people who are in need, I feel excellent.
Yenye nilijua muhimu kupeleka mtoto kliniki ili mtoto apate mashindano zake.
The people who live here, yeah, I care about them very much.
Hapa kwa kijiji, wenye kijiji wamependa watu wa Red Cross. Hata tukiona wakiingia kwenye kijiji hapa tunafurahia kwa tunapatanga usaidizi.
With Red Cross, they will organize so that the babies can be brought for immunization.
I started this one 2010, and I feel it in my heart to volunteer myself on this for our community to change. It's better to take our children to the vaccine in order our children will not be sick for something that we can prevent.
All right, thank you. I like to show that video just because it really hits home how important it is volunteers are to our work and to reach those hard to reach communities. We're able to recruit and mobilize volunteers from those very same communities, which gives us a couple of really significant advantages. First being access to those communities. If you in that urban area that they're showing in the video, that's actually Kibera. It's in Nairobi. It's the second largest urban slum on the entire African continent. It's a pretty dangerous place to go. So it's really hard for services to get into there. But because we have those volunteers who are members of the community, they're respected, they're able to access their community members and provide the messages. And again, being a member of that community, they come in with a built-in level of trust. They're able to more easily deliver the message because the people that they're talking to know that they have the best interests of their community at heart. We move to the next slide, please. All right, so I just want to give you a quick background on what the Measles and Rubella Partnership. The partnership was founded in 2001, and it's currently made up of 7 organizations who form the core partnership of it. Those organizations are the American Red Cross, the Gates Foundation, the U.S. Centers for Disease Control and Prevention, or CDC, Gavi, the Vaccine Alliance, the United Nations Foundation, UNICEF, and the World Health Organization. Together as a partnership, we work towards the overall goal of ensuring that no child dies from measles or is born with congenital rubella syndrome. Over the years, we've been successful as a global health initiative because of what each organization brings to the table and how, through the coordination of our work, we're able to achieve more than what we would be able to do individually. Measles is possibly the most contagious disease known to man. You have to reach 95% of a population with a vaccine to instill herd immunity. But luckily, we have a really good vaccine available that's safe and effective. And because of this, we know that it's possible to one day stop transmission of both measles and rubella, which are provided in the same shot typically, and then thereby ridding the world of both of these diseases for good. Go to the next slide, please. All right. So as a partnership, we've made some pretty significant progress since 2001. With the support of the MRP between the years 2000 to 2023, which is the last year we have full data, measles deaths have decreased by 87% globally. This is from a high of over 800,000 measles-related deaths in the year 2000 to 107,500 in 2023, which, to be fair, is still way too many deaths. The fact that we have a safe and effective vaccine that easily provides lifelong protection means any death is completely unnecessary. So we obviously still have a long ways to go. Through our vaccination campaigns and other activities, we've been able to deliver vaccines to more than 60 vaccines to children, and through that, we've been able to prevent an estimated 61 million measles-related deaths worldwide. Currently, global measles coverage is at 83%. This means that 8 in 10 children globally receive measles vaccines and thereby are protected against this virus. As of the end of 2023, through vaccination programs, 82 countries have successfully eliminated measles, and 93 have eliminated rubella. Within the partnership of note, by the end of 2025, we're expecting Nigeria, Sudan, and the Democratic Republic of Congo to introduce rubella-containing vaccine into their routine immunization systems. With those three, there will only be 16 countries left who will need to introduce rubella-containing vaccine, which brings us really close to our goal of eliminating rubella, which is more likely to happen before we eliminate measles. Rubella is a lot less contagious. So once you introduce the vaccine into a country, cases tend to go down fairly quickly. If you can go to the next slide. So over the next 2 years, we have roughly 38 vaccination campaigns scheduled to take place. Most of these will be in the Africa region, where the burden of disease continues to remain the highest. But we'll also be doing campaigns in the Eastern Mediterranean, Southeast Asia, and finally the Americas region. Overall, we'll be trying to reach more than 318 million children with measles and rubella vaccines during these 38 campaigns. Next slide. All right, so shifting gears to our domestic-facing activities, I'd like to talk to you about some of the programs that we have here in the U.S. to support the MNRP's work. The American Red Cross has a strong tradition of utilizing nurse volunteers within our programs. Nurses are seen as trusted healthcare professionals, so we leverage their ability to reach individuals and groups in support of our advocacy efforts. Each year, we mobilize Red Cross nurses and other licensed healthcare professionals as MNRP volunteer health educators. These volunteers conduct outreach to targeted Senate offices to provide education on the continued global burden of vaccine-preventable diseases and encourage those members of Congress to support critical measles and rubella elimination programs at the US CDC. Next slide. In addition to our work with nurses, we also have a very long-standing partnership with Red Cross chapters who have been active supporters of the MNRP since the very beginning. Typically, these programs involve youth engagement through Red Cross clubs, and youth volunteers. Over the years, youth volunteers have helped us to raise funds to support vaccination programs. They've helped to conduct advocacy in support of vaccines, and probably most importantly, raise awareness within their communities about just how severe measles and rubella infections can be and the importance of vaccinating children here in the US to make sure that they are protected from those diseases. With that, I think I'm wrapping up my presentation here, and I will hand things back over to Neha to move us along.
Thanks, James, for that presentation. I am going to be introducing Annalicia again, who will take us off with, I think, a wonderful interview on what it really means to talk about the local context. And so excuse me a minute while I go ahead and change my slides to the appropriate one. But Annalicia, let me know if this is okay with you, and let me just go ahead and share this.
Perfect. Great. Thank you so much. So we're going to zoom in a little more and focus on some of the work that we've been doing within our regional chapter. So my portion of today's discussion is going to focus on some of the vaccine or just some concepts around vaccine advocacy. So next slide, please. As I mentioned in our introductions, I wear many different hats. So in addition to working as a pediatrician and the different advocacy work that I do with the Red Cross and otherwise, I am also a mom to a 1-year-old, as was alluded to. Next slide. And this is probably my favorite hat that I wear. So I have a 1-year-old right now, and she is vaccinated. And interestingly, it adds a lot of Next slide. So when we think about how to talk to folks about vaccinations, I think it's interesting to look at the lessons that we took away from the COVID-19 pandemic. So this is just a picture of Times Square in 2020. And I think when you ask, what have we learned? The question really depends on what you mean by we. As a public health community, I think we've learned that messaging about scientific topics can be very, very challenging. And honestly, talking about any complex topic in today's media ecosystem is incredibly difficult, but at the end of the day, I think there is no denying that messaging matters. So in addition to the coronavirus pandemic itself, I think we are also dealing with a misinformation epidemic that continues to this day. Next slide. We're really seeing this play out in the realm of measles because, as James mentioned, once vaccination rates start to dip, it's so contagious that we'll start to see outbreaks much more frequently than some other vaccine preventable diseases. Next slide. And I think part of the challenge now, coming back to this concept of messaging, is that we're missing something. We can literally prevent child suffering and prevent child death, which seems like everyone should be on board with that kind of thing, right? Full stop. And somehow people are getting confused about these concepts. Next slide. The other thing that I want to highlight is that this is not normal. The fact that we are now seeing deaths in the United States from the measles is unprecedented and very unfortunate that we are moving in this direction. And so we need to keep in mind that people's perceptions are going to shift based on what they're seeing in different media formats. But next slide. I think coming back to the idea of what lessons we took away from COVID, I think fear is very powerful, but we need to understand how to channel that fear and kind of frame risk perception. Humans, we are just so bad at risk perception. And I think it's why we're more afraid of sharks than we are of texting and driving. So I think this ad or this billboard is very powerful. And I'll admit, I haven't really figured out a catchy equivalent that we could put on a billboard for vaccines, but if you have any ideas, feel free to run them by us. Unfortunately, as a pediatrician, I have watched kids suffer and even die from vaccine preventable diseases like the flu or the measles. And it's really tough because I know that parents are always trying to do the best that they can for their kids, just full stop. And so coming back to that question of where are we going wrong? Next slide. I think there has been a societal shift in how we view professionals and institutions. COVID, again, was a great example of that. And while we haven't quite figured out how to perfect our messaging in today's media ecosystem, I think there's not going to be a one size fits all solution. And so in the few minutes that I have with you, I did want to touch on some ideas that you can hopefully take away from our discussion today. And just recognizing that communication generally is a big game of telephone. And even if you have the perfect message, if the listener doesn't actually hear it and internalize that message, then you haven't really achieved your goal. Next slide. So while we can definitely dive deeply into each of these topics, I just wanted to try to distill it down into these kind of three key components when we're thinking about messaging around vaccinations. And so the first is that the message has to come from a trusted source. And while that can sometimes be a physician, definitely do not underestimate your influence as a friend or a loved one. And again, when it comes to vaccines, bonus points if you're a parent. You'd be amazed how many parents I counsel in the clinic are mostly reassured once they hear that I'm a mom. When it comes to the message, those of us who train in the sciences are often persuaded by data. Yet, I think it's very important. I can't emphasize enough that we have to recognize that we are emotional creatures with a capacity for reason, not the other way around. And if we don't address the emotional piece, we've already lost the message. So when friends of mine are skeptical about vaccinating their kids, sure, I can talk to them all day long about the pros and cons of vaccinations, the side effects, the risk factors. But I also tell them, and I think what actually convinces them more in many cases is just helping them understand that I and all of my pediatric colleagues who are extremely well versed in all of these and have seen kids who get these diseases, we have all made the choice to vaccinate our own kids. Finally, I think it can be really helpful to just take a second and really try to understand how someone sees themselves. So as I mentioned earlier, every parent who comes into my clinic truly wants what is best for their children. and every person sees themselves as a critical thinker, which brings me to this last piece of the equation, the audience. While everyone may see themselves as critical thinkers, next slide, please. There is the potential to improve critical thinking skills. I know each of you is capable of going to the CDC website and reading about vaccines and their side effects. So for many people who are actively seeking information to make an informed decision, that can be incredibly useful. In fact, some of our volunteers have worked with me to create op-eds to help make that information as visible as possible. And much of the work that our team regionally has been doing, which my colleagues will expand on further, focuses on those types of efforts. But in the last few minutes that I have with you, I want to focus on these couple pieces that I've highlighted here. How can we try to help people improve their ability to think critically about the information that they're consuming? Next slide, please. One thing that I had highlighted in terms of the audience is making sure that they're receptive. Something that we learn in medical training is how to have difficult conversations with people about topics and their willingness to change, whether that's stopping smoking or getting vaccines. And so sometimes you have to recognize that your audience may not be ready to hear that message. So this is one theory that we utilize in our training called the trans-theoretical model of change. But all I want to focus on is this idea that many people who are vaccine hesitant or anti-vax may be in the pre-contemplation stage where they're just not ready to have that conversation yet, and that's okay. But once someone actually moves into the contemplation stage and they're actually thinking and trying to understand, take in different information, take in different sources and make a decision that feels like it's the best for them and their families, I think there's an opportunity that we can help people, again, build those critical thinking skills. So next slide. So if we think about trying to come up with an antidote for misinformation surrounding vaccinations, I wanted to introduce this concept that I think is really exciting, and it's called media literacy. And so this is just the idea that people are faced with so many different sources right now, whether it's social media, different media formats, and again, coming back to COVID, people have not had a great ability to identify those sources and think through them critically. So different groups have come out with toolkits and built like structured ways to approach this concept of media literacy and to really become those critical thinkers that everyone wants to be. And so I highly encourage you to look into this concept. There are free resources out there. This is also something that's being advocated for in different policymaking settings, both regionally and at the state level. And so this can be used not just for kids at school age levels, but for people of all ages. So hopefully this has given you some food for thought when thinking about the different ways to address the challenge of vaccine advocacy and vaccine misinformation. So with that, I will stop there and pass it back to Neha. Thank you.
Thanks, Annalicia. I think you shed a very light on a very important topic. I think that's really what we're trying to do at the local level. The Northern California Coastal Region team is trying to tackle, vaccine advocacy at the local region, and then we also want to empower youth while we're doing that. So we'll talk a little bit more about one of our key projects that aims to do exactly both of those things. We are in the process of producing a documentary series. It's a short modular video segments that highlights both what the American Red Cross is doing for global measles and rubella eradication, and then also providing local U.S. youth education on what it means to get vaccinated, what it means to, grow up and decide to get vaccines, whether for yourself or your children. And so with that, I'm going to go ahead and provide a brief overview again of myself and Peter. I know that we went over this, but I just do want to emphasize a couple other roles that I do play. So I studied at UC Davis, and I started off as an immunologist and microbiologist at the Center for Comparative Medicine, where I did actually study measles. So it's kind of a full circle movement for me to come to the American Red Cross and do something else on that front too. And then as a person studying public health, I'm also an advocate for South Asian public health at the South Asian Public Health Association. So a lot of issues related to South Asians in the diaspora. That's what we kind of go ahead and work on. And of course, love to work with American Red Cross, as well as my current job at Roche. But with that said, I'm going to pass it over to Peter, who can introduce himself as well. He will be co-presenting this segment with me.
Thank you, Neha. So I am Peter. I am, as I mentioned before, I'm a third-year human biology student on the pre-med track at UC Davis. But aside from my formal academic career, I'm also an EMT for Life West Ambulance out of Sonoma County. As an EMT, I primarily do critical care transports, so transporting patients from between ICUs and emergency departments. But also at UC Davis, I'm involved in two different types of clinical research through programs called Research and MRAP for surgical research and emergency medicine research, respectively. But on the UC Davis campus as well, I'm involved with the Myomatrix lab where I do muscle stem cell research. But other than that, I am a big public health advocate, which drove me to join the Red Cross. In 2023, I read that there was over 100,000 deaths of measles, which deaths from measles, which was a great decrease, as James Noe said, from 2000, but it's still too big of a number. And so that's what inspired me to go into the Red Cross and join the team. But also, I've been doing this at a local level in the Davis community, where I have been going to middle schools and teaching middle schoolers about infectious diseases, how they're transmitted, and how we can prevent ourselves from contracting infectious diseases. Yeah, thank you.
Thanks, Peter. So before we dive really in detail into our documentary series, we want to build a case for why we're doing this. So some of the questions that you guys might ask are why vaccine advocacy, why concentrate on the United States, and why do it now? So we have a couple of interesting figures for you all to take a look at. So the first one that we have here is talking about vaccination rates for measles and rubella, or sorry, diseases from measles and rubella. And that kind of falls down in the 2000s when globally a lot of countries start to uptake these vaccines more rigorously. Of course, you can see it's not at zero, which is where the national work for the measles and rubella program that James was talking about really plays into effect. But that's all to show that cases have been decreasing dramatically. We've gone from the millions to, quite a low amount. So these vaccines are really, really great at what they do. So then we bode the question of why do we still have outbreaks in the United States, despite these vaccines having been licensed for a very long time, since the mid 1900s, specifically for measles. And here we have a graph of the outbreaks that have happened in the United States in the recent years. In 2019, we had that big spike of over 1,000 cases. And this graph here is actually from February. So if you are to account for the Texas outbreak that is occurring right now, we're at 560 cases counting, and we're not at the middle of the year yet. So we can only hope that this does not surpass 2019 rates. So this is a little bit troubling, and you can ask, why is this happening? That kind of goes back to some of the points that Annalicia has brought up. So we are seeing the share of U.S. kindergartners who've been vaccinated for these falling below the recommended federal thresholds. And of course, a large part of that drop has happened because of COVID-19, where people were unable to go into their physicians' offices and get their children vaccinated. But since before the COVID-19 pandemic even, we've seen parents becoming more and more hesitant about vaccinations for their children. And since the pandemic, this number has only increased. So that's, I think, where we come in, right? What can we do as an organization that works on tackling measles and rubella vaccines globally? What can we do in the local area? And that's where our team comes in at the local level. We've had a lot of different projects, and I'll just briefly talk about them. We've had a curriculum series meant for nursing schools that's established in a partnership with the American Red Cross Academic Service Learning Project. We've had a lot of vaccine hesitancy talks and op-eds, which Annalicia has gracefully led. We've had youth activities that are themed for measles and rubella that a lot of high school students and clubs can take on, and this is currently in backlog for approval at nationals. And Annalicia has also hosted a youth career webinar series to really empower youth to decide what sort of careers can I do that come across in the humanitarian front, right? So a lot of that has been targeted towards both vaccine education and then youth career guidance and empowerment. Currently, we have two ongoing projects. One is a youth health symposium that's run in partnership with the Silicon Valley Red Cross chapter, as well as the Stanford Department of Pediatric Education. This is targeting high school students. We actually had our first successful run last year with round 2 planned for October of this year. So we're ramping up for that. And of course, the vaccination documentary, which will be the rest of this talk. And this is actually a pretty interesting project. This started, I think, about a year and a half ago, and that's right about the time I think Peter joined too. And this was actually run and kind of spearheaded by Joe Clendenin, who is a retired physician. He was the previous lead for this program before Annalicia and I stepped up. And so since then, we've taken this forward. The real goal of this is to provide vaccine education as well as education about the diseases that vaccines can prevent. We want our audience to be youth, whether that be high school students or early nursing students within the Northern America context. And so we want it to be also modular. So whoever is the person watching or selecting these videos can pick and choose what they want to go ahead and cover. And we'll provide a brief list of the topics we want to cover as well. And these modules, we want to provide credence to them. And we're doing that by interviewing experts within their field. So I have a photo here of Dr. Lisa Babel. She is an infectious diseases physician at Mass General. We've interviewed her and it was a really great video segment that came out. She also works in global health. So she's able to provide a little bit of context, interestingly, on how vaccine hesitancy can play in Africa, for example, versus the United States. And so with that said, I'll provide a brief overview of the topics that we want to cover. So again, instructors can decide, for example, if you're presenting it to nursing students, maybe they're doing a segment on infectious diseases. They can choose that module. Maybe they want to learn about the immune system. We have a module about that as well. Maybe a high school student is interested to see how safe vaccines are. We have a segment on that as well. So we're trying to make it as modular, as relevant as possible. And of course, we want to hit home on vaccine safety and equity. And that's why we actually have a dedicated segment on vaccine myth busting as well, which our expert interviewees actually lead quite nicely. And so with that said, I'm going to go ahead and pass it off to Peter, who will provide the details of what we've done so far.
Yeah, so since the start of our project, we've had a few big wins. I think first of all, we've been able to conduct 7 full interviews with experts in infectious disease, vaccine advocacy, and medicine. And so we've had 3 physicians, one of which is Annalicia Pickering, who you guys have met. But we've also had Mike Lozardo, who is a pulmonologist out of Florida. And we've also had Dr. Lisa Babel, who was in the screen before, who's an infectious disease specialist. But aside from physicians, we've had 2 researchers. We had Dr. Suzanne Carpenter, who's an innate immunologist out of UC Santa Cruz, and Dr. Koen van Rompuy, who is a veterinarian and infectious disease researcher who actually played a big role in developing the HIV vaccine. But other than these experts, we've also had a vaccine advocate, and we've had a COVID-19 patient share their experiences with infectious diseases. And so we've had quite a few interviews. They've all went really well so far, and we're planning a few in the future. Secondarily, our team has also expanded quite a bit. So initially when I joined, the team was around maybe 6 people. And so we've actually doubled our team to a little bit over a dozen. It includes pre-meds like myself, grad students like Neha, and young leaders in healthcare, which is actually the backbone of our team. All these high schoolers have kind of came together and have had a shared passion for infectious disease awareness. We've also been able to partner with industry leaders, most notably Sierra Duran, who is a senior video editor at Stanford. And she's been able to bring in her expertise in video editing, but also AI tools that we'll be talking about. And she's been incredibly influential in bringing this project to life. We've also been able to collect added resources. There's a PhD candidate at UC Davis, whose name is Marco DeLoca, who's actually doing his dissertation on vaccine hesitancy. And so he was able to provide us with the documents that tackled hard questions about vaccine hesitancy and why people are hesitant. So he organized this document for us to supplement our video modules with. As Neha mentioned before, we've also been able to generate a format for targeted content in which we have a modular design that is specifically tailored towards nursing students and youth advocates. And then lastly, we have a lot of diverse perspectives coming into this project. Not only is there diversity within us as a team, but there's also a big diversity, lots of diversity within our interviewees as well. We have people from all across the country who span different fields of expertise. And so we've had quite a few big wins that we're pretty proud of. If we go to the next slide, I could share with you guys some of the tools that we've been using. And so we've been using a few advanced tools and analysis techniques. A lot of this has been inspired by our video editor, Sierra. Firstly, we've been using a platform called Notebook LM, which is a Google AI platform that basically allows us to do two things. The first of which is it allows us to fill in our knowledge gaps. The second of which, it allows us to check our own biases. And it does this in a pretty interesting way. So our high schoolers have been finding online resources to get information on each of the video modules. And so what we've done is we've taken all these sources, put it into Notebook LM, which you could see on this left side here. And what it does is that it can summarize all the information that we've found in our sources, but it can also identify the knowledge gaps. It could show us which information on this topic that we did not include. And so this is super helpful because not only does it check our bias, in which we're searching for the sources, and so we have inherent affirmative bias there. But it also allows us to pick our next interviewees and allows us to explore topics that we haven't thought of before. So Notebook LM has been kind of like the groundwork of who we decide to interview. If we go to the next slide, I could share with you Descript. So Descript is a video editing platform that is script-based. And so once we have our interviews, it generates a script for us that we could then directly edit the script. And by editing the script, it edits the video itself. The good thing about Descript is that it's very user-friendly. So a lot of our team doesn't really have a lot of experience with video editing, and so that's been really useful. But it also allows lots of people to work on it at once. You don't need to begin editing from the start and go to the finish like traditional video editing techniques. People can start from the middle, and so that's been an amazing tool that we've been utilizing. Next slide. And so this slide here, I wanted to put pretty much a collage of some of the clips that we've had. I want to show you guys some of these interesting clips. So if you want to play the video, I'll mute myself so you guys can hear.
End of March, I got COVID. They basically decided that they would induce me in a coma. And the hardest thing was definitely what the experience put my family and friends through. In some ways, kind of seeing your own eulogy.
For most of us who dealt with COVID and deal with public health related diseases, the biology and the medical part is the easy part. But the real challenge was kind of navigating people's preconceived notions and a lot of the same things that sort of spill over into the negative things that people think about vaccines. I think have that conversation with your providers. I mean, I think that's the key thing. Talk to the experts who know about healthcare issues. You are still, with talking to experts, not all experts agree, and not all experts are created equally, right? So seek out information, from reliable sources.
I heard somebody describe it as if you took lots of people and everyone put up an umbrella, and there was a couple of people that couldn't put up the umbrella, and it started raining, you would still protect them from the rain because there's enough umbrellas up there. That is effectively what herd immunity is, that if you have enough people vaccinated, it provides enough protection that an outbreak just won't begin.
Thank you for that. Yeah, so those are a few clips of some of the interviews that we've had. We have, hours of clips that we are planning to continue sorting through and bringing this all together. So if you go to the next slide, I could share some of our next steps.
End of March, I got COVID.
All right, so our plan is by summer 2025 to complete our remaining interviews to make sure that we have content for each of our modules. And then hopefully by fall, we can spring into production, which will include scripting, using the resources that our high schoolers have pulled together, and then creating voiceover content for that. And so the voiceover content will be using the script over animations and then integrating these clips to make a full engaging series. And so I could show you guys some of the animation samples that we've had in this quick little video. And so we've had even this animation was produced by a high schooler who joined our team. And so this little Red Cross character is the protagonist that we'll have throughout each of our modules. And you can see they're fighting infectious diseases. And so hopefully this is a nice, intriguing, and engaging way for our young audience. And then by winter 2025, we hope to launch a limited series towards special focus groups for global vaccine education efforts. And then hopefully in spring 2026, we'll be able to translate this launch into a full national scale launch of our documentary series.
Thanks, Peter, for that. So now we do want to go ahead and introduce you all to two of our high school members who are working on the documentary series with us. They're passionate youth vaccine advocates, and they can perhaps speak towards the cause of, gaining hands-on experience, building maybe new skill sets within the context of global health and public advocacy. So without further ado, I do want to go ahead and pass off the mic to Sang-Wee.
Hello, as mentioned before, my name's Song-Wei, and I'm a senior at Harker, and I'm interested in being pre-med. I'm particularly interested in public health and health policy. I joined the Measles and Rubella Partnership team last year after attending the first Youth Health Symposium, and I learned a lot about the different initiatives that Red Cross does and the importance of vaccination from that symposium that I didn't know about, so I decided to join the team. I think Red Cross is uniquely positioned at the intersection of global health, community outreach, and education. And a really special part of it is that Red Cross tries to build like long-term sustainable connections that combines like international and global public health with local engagement, which is a part of what the MRP team does, and particularly the youth engagement part of it. And I'm incredibly grateful to have had the opportunity to be part of a meaningful platform and be able to contribute, learn from experts, and overall help shape a more informed future. Aside from Red Cross in general, I'm the president of Women in STEM at my school medical club and HOSA, which is like a competition where students can learn about a variety of different healthcare careers and like practice certain skill sets. So as the president of Symposium, I organize an annual research symposium with over 700 attendees and also do STEM Buddies experiments, which is teaching other younger students about STEM subjects. In addition, I'm an avid debater. I've been a part of the varsity debate team, which is the photo on the top left, and then wisdom photos are the top center, the top right, which has taught me to stay updated on current events and approach issues from a variety of different perspectives, which being a part of the Red Cross team has definitely helped with as well. In addition, I'm on the Santa Clara County Youth and Young Adult Advisory Board for Sexual Health and STI Stigma, which aims to reduce stigma and reduce infections. On the Red Cross team, I've participated in the vaccine op-ed that Dr. Pickering mentioned earlier. By helping out with the op-ed and helping write it, I learned a lot about the dynamics that inform vaccine hesitancy aside from just the scientific factors. Like Dr. Pickering mentioned earlier, even though a lot of myths have been disproven by evidence and scientifically, a lot of times I learned that the root of the hesitancy is that we need to build trust in the medical system and the context that surrounds it instead of just purely the scientific aspect. Additionally, I'm a part of the webinar team series, which tries to give other communities which tries to inform other communities about opportunities in healthcare careers. And finally, in MRP, I'm a member of the documentary team, and as a youth volunteer, our role is mainly to gather information points, develop interview questions, like conduct the interviews, gather data on what kind of documentaries and modules would be useful. From all of these experiences, particularly in Red Cross, I've really learned how to create a meaningful educational resource and learned how to communicate science and communicate health effectively in a way that's accessible to the public. to make sure that all of the resources are comprehensive and tailored to the audience. Overall, for youth involvement, I think we as youth can offer a uniquely powerful perspective for health advocacy, and we have the power to engage our peers and engage our communities on another level that can be meaningful and important for advocacy. And it's particularly important for us to be informed and teach others in our community, whether it's our friends or family members, about the importance of vaccines or other health topics.
Thanks so much for that. I think that was a great call to action as well. And so with that said, I'm going to pass it off to our last speaker for today. Annalicia, do you mind coming online and talking a little bit about yourself?
Yeah, so like Sungri, I'm a senior in high school, and I go to Basis in Independent Silicon Valley, which I previously mentioned. I guess for me, the COVID-19 pandemic really sparked my interest in vaccine advocacy and public health. Like at the time, I was in 8th grade, and like public health was completely new to me. I've never heard that term before, and honestly, maybe the first thing I thought of was how I wouldn't be able to play a sport, table tennis, competitively too much anymore due to quarantine. But like as I've learned from the news and the media and everything, I found in general in my community that misinformation about vaccines was like a really pressing issue. And so when I was in 8th grade, I created webinars and newsletters for my local sports community, talking about like different mRNA vaccine developments and just relaying the importance of sanitary guidelines, especially as sports players. And so that's kind of where my journey with vaccine advocacy really started. And as time went on, I became more interested in vaccine development on the scientific side. I was listening to this Hopkins Bloomberg of school public health school podcast, and I learned that the Nipah virus had high transmissibility and life-threatening effects like encephalitis. And so sooner or later, I find myself joining a lab to work on the Nipah virus mRNA vaccine development side. And on the bottom, there's a picture of me presenting at the American Chemical Society for my research project. And then on top of that is another picture of me at lab. Ignore the messy work background. So I guess other than advocacy and research, I found it really important to volunteer and create safe and inclusive spaces. So in 10th grade, this is around the time when I started becoming involved in the NCCR Red Cross. So I founded my school's Red Cross Club, and we host annual volunteering events in general for a lot of different causes. On the bottom at the right, there's a picture of our annual Halloween events for kids with Down syndrome. And so in general, my goal is with these events, and as I assume other clubs in the region do too, is to create bridges in the community and address like loneliness. Other than that, my Red Cross Club, we talk about and educate my peers about other topics like first aid, international humanitarian law, and of course, measles and rubella, which is like a really important topic to discuss right now, and other public health priorities in my club. So that's like a little bit about me and my background, but for my involvement with Measles and Rubella Partnership, I attended the Stanford Youth Health Symposium last year with my other Red Cross officers like Sungri, and I found out about the documentary series and how it was focusing on like not only vaccine education, but also the hesitancy aspect. And so I just had to jump at the opportunity. I think it's really important to use science as a transformative force to help people realize that global health affects everyone's health and why immunization matters. But aside from that, I think it's also really important to address the importance of vaccines in the most non-judgmental, empathetic, and empowering way as possible. And I really think that this documentary will do that. On the top right, there's a picture of me recently attending a premiere of a film called I'm Still Here, Love, which is about COVID-19 misinformation and disinformation, and how sometimes people's grief can be marginalized through media and like their community. And so as we continue to work on the documentary project, I hope we can make a really huge impact across the nation. I'm excited to continue my academic journey at Hopkins, which will be a very next interesting 4 years, considering how I'm going to be majoring in public health. But yeah.
Wonderful. I'd like to thank you all for this. There are a number of comments and questions in the chat, but I also wanted to mention when James Noe explained, it's one of the most contagious diseases, measles rubella is in the world. It's like you can be in a room within 10 hours, be in the room 10 hours after somebody with measles has been in it. And but just by breathing in the air, you can get measles. And it's most dangerous in developing countries where people live in rural areas. It's hard for them to get to medical clinics, or they already have an already arrested immune system. They're more likely and more susceptible to die of measles. Whereas in the United States, we have good healthcare clinics. We have the ability to get to a doctor or a nurse or an emergency room, and it's easier in terms of the United States. And so I think it's a very vital thing that you, as the region, are doing with doing documentaries and looking at measles, measles, what I call forwarding measles information and education, as well as other communicable diseases. And I'm going to go through some of the questions for you. And if other people have questions, maybe they can raise their hands. Did somebody want to say something? It sounded like somebody went off mute. Nope. Okay. Anyway, I'll start off with a comment by Liz Dietz, who said she's 45 years disaster health services RN, volunteer manager and Pacific Division advisor of disability integration. Almost 56 years as an RN. Right now, she quotes, "I am damn scared for what Kennedy is doing for health on the federal level." Then there's another comment from Sandy Rose. "It seems to me that seeing which modules for users are more drawn to immediately can assist in determining where to put the focus and help with designing your approaches." Laura D says, "How do you deal with the reverse of herd immunity analogy? People who say that they have the right not to use an umbrella, and that if other people think umbrellas are important, those other people can use them." And then let's start with that question. Would anybody from the panel like to answer that?
I'd be happy to lead off on that. So I think that is one of the main challenges we have in getting past this hump. We've been at around 80% coverage for almost 20 years now, and we have not been able to get that last 15% because there's vaccine hesitant people. There's it's hard. There's people who are in hard to reach areas. Here in the overseas, we don't have as many vaccine hesitant issues because people have seen measles. They've known somebody who's died from it. They've maybe had family members who've died of it. So overseas, it tends to be easier for us, especially in where we tend to work in the Africa region. It's more about getting information to them to let them know where they can get the vaccine. Here in the U.S., we've been a bit of a victim of our success. Measles was officially eliminated back in the year 2002, I believe. So a lot of people haven't seen measles. They don't know that it's a disease. Some people think it's no longer around. They don't know how deadly it is. I believe it's 1 in every 1,000 individuals who contract measles will get significant secondary conditions, encephalitis, blindness, deafness. Right now, with the current outbreak in the US, I believe it's 17% of cases that need to be hospitalized. Most of those are in children under the age of 5. So it's a serious disease. When the people who are who, as you said, don't believe in umbrellas. Believe that if herd immunities, if vaccines are your choice, that's fine. But I choose not to do it. I think there's a case. People do make the case that vaccines are a personal choice, but I think there's also a stronger case to say that vaccines are part of the social contract. Basically, as a member of our society, individuals sometimes have to give up rights for the good of the overall group. Vaccines are an example of this. You are not, when you're choosing to vaccinate, you're not only protecting yourself, you're choosing to create a shield between the members of your community that don't have that choice. The people who are immunocompromised, children who are too young to receive the vaccine, people who are older and maybe a vaccine, their immunity strength has waned over years. You are standing between that person and their potential death. So I believe there's a case to be made to say that vaccines aren't necessarily a personal choice because it impacts the people around you. So it's a difficult message. It's really something that we struggle with getting across, but there is that component of it, of being a member of this society. You do have responsibilities to those around you.
Thank you, James. There's another question. Okay, excuse me just a second. What programs are we using to educate pregnant women to get vaccinated? Some are skeptical regarding the shot for fear of autism. Annalicia, did you want to answer that?
I believe Annalicia may have stepped off, Jill. I tried to search for her,
okay.
and I think she's not on the panel. She might have had a call or something from work.
Would one of the others of you be willing to answer that?
Sure. I'm not sure, James, if you know anything about what is done abroad, but you can go first if you do have details on that. And I can follow with maybe some of the folks we've talked to on our interview series.
Yeah, absolutely. And so abroad, again, it's more of a case of getting information about where people can get the vaccine, more than trying to convince them to take it. With the rubella vaccine, it's not as mentioned, it's not available in every country. A lot of countries have not, or not a lot, I guess 17 countries have not introduced rubella-containing vaccine into their immunization systems yet. So the mothers and others in those countries don't even have the option to get it. But in the countries where it is available, I think the messaging is more around explaining what rubella is and the importance of making sure that pregnant women specifically are protected from rubella. Rubella itself is a pretty mild infection. It goes away on its own for the most part with no lasting side effects. It doesn't have the same issues as measles does with encephalitis and blindness and deafness. But where it's dangerous is if a pregnant woman contracts rubella, especially within like the first trimester. I believe it's like a 90% chance that her unborn child will contract the virus, and that can lead to miscarriages, stillbirths. If a child makes it to term, it's almost guaranteed that they are going to be born with congenital rubella syndrome, which is just a horrible host of birth defects that can include blindness, deafness, congenital heart issues, developmental issues, and a person born with CRS will typically require lifelong care, which is a burden to themselves, their families. So explaining the seriousness of rubella is really kind of the most important part of it, and especially making sure that girls receive the vaccine before they reach childbearing ages.
Thank you, James.
And I just want to mention Liz Dietz' hand's been up. I don't know if she had a comment. I know she's an RN.
Oh yeah, no. What I was trying to do is go via the order of the questions, and then Liz is the person that I was going to raise her hand. answer her. I know I've seen her hand raised. I was waiting to.
Thank you.
Sure, Lizzie, I know you're there.
Okay. I truly appreciate and approve of everything that's been said. No issues there. I am scared deadly about what is happening at the federal government. What that Kennedy has done to CDC, our removal of our membership in WHO, what we're telling our people in community health settings, what some of the religious aspects. I am more frightened about what's happening here. And I think we need to talk about what is happening here because people aren't going to consider all of the particular issues. And the two wonderful people from school and the young man in college, you're going to be in the middle of all of this if we don't, in fact, get some better care at the government and some better understanding. This is frightening. I've seen it. I mean, 56 years as a nurse, I've seen it all. And I continue to be in community health and public health. I've been a professor emerita from San Jose State. And as I said, working with Red Cross. Thank you.
Thanks, Liz. Sandy R. said she caught measles and rubella as a child in New York, US decades ago. She had 7 siblings, so if there was anything infectious in the area, one of the kids would bring it home. Oops, I just lost it, sorry. And then she said one of the kids would bring it home. Where is it? I just lost it again, sorry about that. She said, and she remembers how terrible it was for some children becoming deaf, blind, and dying, with pregnant women having major complications. Important subject. The second question is from Elizabeth S. How would you become involved in this program? Any one of you can address that. Elizabeth, what region are you from? Can you unmute yourself and tell us what region you're from? Or can you put it in the chat?
Yeah. Yes, I'm currently living in Michigan, and when I was with the British Red Cross, I was a British Red Cross nurse, and infectious diseases was my field of expertise, but I wasn't thinking specifically about me. I've got a granddaughter that just graduated with her BSN a year ago. And she's currently working in pediatric oncology and is very, very interested in this. And I'm specifically thinking about her, and this might be an area that she might want to become involved in.
James, do you have an answer for that? I point my fingers at you because you're the national person. You know the United States. I don't as much.
So as mentioned, we have a long-standing partnership with the Red Cross nurses. The National Nursing Network has been very gracious in helping us with our advocacy work over the years. I currently maintain a roster of Red Cross nurses who are interested in supporting advocacy work. I'm trying to get at least one volunteer for every state. The states that we target for congressional advocacy changes each year depending on the committee membership of the Senate Health, Education, Labor, and Pension Committee, the HELP Committee. That committee sets the budget for the US CDC's programs and kind of holds the pen for appropriations. So we specifically target those offices for in-state visits. So right now there isn't a senator from Michigan on that, but that may change. So if your daughter is interested in, or if you're interested, I'm happy to add a nurse or any other licensed healthcare professional to that roster. You'll get information about our programs monthly, and if we each year around January we activate the nurses in the usually it's like 21 states. That's the number of committee members on the HELP committee. So we try to recruit at least 21 nurses. We train them, give them materials on what our key message is, provide them with different resources, and give them training on how to contact their congressional office and set up a meeting. It's It's usually a couple weeks of volunteer. It's definitely not a long-term volunteer commitment, but it's a very important work, especially in our current climate. Right. So feel free to email me at I'm at measles@redcross.org, which is a super easy email address to remember.
Okay, thank you. Do you want to put your email in the chat, so just for
absolutely
that aren't as auditory? And then the next question: in the future campaigns, why are some regions targeted for measles only and some for measles and rubella? The map slide.
All right, so back to me. Okay, so some countries have, as mentioned, have not yet introduced rubella. It takes a lot of money to add a new vaccine into your routine immunization schedule. Once it's added, it doesn't come out. So a country has to make sure that they have the funds every year to provide that vaccine to each new birth cohort. So some countries have not yet been able to introduce it. There is support globally to help countries with introduction and paying for vaccination, the cost of vaccination, as well as to conduct vaccination campaigns. Those funds are provided through Gavi, the Vaccine Alliance. Gavi has a certain requirements for countries that they have to meet before they're able to provide funding for introduction. Right now, there's the threshold. The current policy that they're using is a country needs to have reached 80% measles first dose coverage. And that could have been during routine immunization, or it could have been during a national vaccination campaign. If a country hasn't reached it, the Gavi isn't able to provide them with funds yet. However, just this fall, the Measles Rubella Partnership, we did a concerted effort to change policy at WHO. We presented a compelling argument at the SAGE meeting in September. SAGE is the strategic it's basically the group of advisors that lead WHO as far as immunization policies. We did a presentation to them, and they agreed that the threshold of 80% should be removed. So right now, that's no longer WHO policy. However, Gavi is still in the middle of a very important time for them. They're doing a replenishment where they're asking countries around the world to provide money for their next 5 years of operating budget. So they haven't been able to change their guidance, but as soon as that changes, that will open up the window for the remaining 17 countries to introduce. So that's kind of where we're at right now as far as supporting rubella introduction versus only measles rubella introduction versus only measles monovalent vaccination campaigns.
Thank you, James. And then there's some comments here. In our large and somebody commented, in our large multicultural family, the topic of vaccination is divided family members, which has actually caused the physical shunning of family members who won't vaccinate. I see this happening in other families and in daycares and schools. And then Laura responds to that in the chat, and she says, is it shunning or people taking precautions for their health? And it has to do with perspective, just as we take a neutral and impartial part within the Red Cross to not point fingers and say, well, they're wrong or they're right, that people have different positions or different points of view. Then the following comment was, does a documentary series include experts from both sides of the vaccine debate? I think somebody wrote, April, said she thinks it would be far more effective if it did. From the clips shown, only one side was being addressed and would instantly antagonize half of the audience. Are there credible experts on both sides?
I can give this one a shot, Jill. So thanks for that question, April. So the goal is for the documentary series to primarily get high school students awareness for vaccines before they strongly even become anti-vax. So this is to equip them with the knowledge to make the decision and understand that vaccines are safe. Of course, if students go forward, want to share this with maybe their parents, their relatives, friends, whatever the case may be, we do have maybe an ethos that speaks to, if you're coming not from a science background, how do you relate to maybe questioning your own beliefs that are vaccine hesitant? And we actually have reached out to a couple folks in the vaccine awareness campaign community who used to be anti-vax themselves. So we have a parent, and this actually I think speaks to the umbrella question from earlier, right? How do you get to folks who want their own choice to be no umbrella, right? So she was saying that that's where she started off from, right? She wanted to only talk about her family. She didn't necessarily care about protecting other people in her community. That was not her first thought. And so to make that personal choice, and this is how she put it, she went to her physician and asked, what are vaccines? How are they safe? Can you tell me about that? And the comment that she received back from that doctor was that, are you an anti-vaxxer? And then he laughed her off. So that's one of the first points in her personal experience that made her question not vaccines at first, but the medical establishment. And so losing that trust, and that was her first incidence of losing trust. And then she followed that up with another incident where her baby at the time had a very, very bad infection and nobody trusted her in the emergency room. Only until last minute. So that second scary experience really made her question the medical system. And that, I think, lack of trust then precipitated into questioning vaccines and, other things like that. So when these folks are talking to us, they're talking about the ethos of things or rather than maybe the science. So when you ask, what are the experts on the other side of the debate? I wouldn't necessarily call them experts. I would call them folks who are using, maybe the gaps in credibility or trust that a lot of folks don't have in the medical establishment. And I think that goes to what Annalicia was saying, right? How do we as folks who do the science, who try to treat people, how do we make it more easy to understand and also build that trust? I think that's where you really need to go rather than showing both sides of the debate, because I think, personally, what I see the risk of that being is that someone's not able to necessarily differentiate the science-based facts. A lot of what we're seeing within the anti-vax rhetoric is using a seed of science and then, blowing that off into non-science. And if you don't come from, if you don't have a PhD, it's really hard to tell where the science stops being science. So that's the real risk we run of doing that. But hopefully that answered your question. And I think Peter or the rest of the high school students, James, even if you want to add to that, feel free to do that.
Yeah, I think you answered that perfectly. Yeah, there even are experts that we've talked to who specialize in infectious diseases and vaccine development. They do also claim that, vaccines aren't 100% perfect, and some people may experience side effects from vaccines. However, the risk of side effects of taking a vaccine is greatly outweighed by the benefit that they have in our societies and the amount of people who have been saved because of vaccines. Just going back to that figure that James Noe showed at the start, we had over 800,000 cases of measles that have been reduced between 2000 and 2023. This is deaths per, yeah. So we've just had a great dramatic decrease in the number of deaths because of vaccines. And it's not just measles, but vaccines in general. Yeah.
I had a question, if you would be willing to answer it, James, or any of you on the panel. I remember what they call the social mobilization campaigns in Africa, where people would who were volunteers who would go by bicycle or by boat to the nearest village with their vaccination icebox full of vaccine, but they'd go ahead 2 days ahead and educate the community by doing what I call improvisational theater or dance or music or having kids draw. And in Africa, there used to be a film where they painted their little pinky red because it showed that they had been vaccinated. And you'd see 20 kids, and 18 of them had the red paint on their little finger. And that was a social mobilization campaign. If you would address that, and also the what was it? Not just a social mobilization campaign, but Vaccinate a Village. Does that still exist?
Yes. So what you're describing, the social mobilization campaign. So two kind of separate things. One's the social mobilization, which is kind of the demand creation and providing information to communities to make sure that when vaccinators get to that area, there is demand for it, that people will come in, that children will be receiving the vaccine, because you can put all the doses in the world into place. If nobody shows up, coverage doesn't improve. We still do that. That's our bread and butter at the American Red Cross. We mobilize volunteers to do the house to house. We do occasionally provide them with bicycles still if it's rural areas, and if a volunteer has to go a couple kilometers to get from one house to the next, it just makes sense. So we're trying to reach as many people as possible for that. There's a lot of different ways of doing social mobilization. Typically we try to do the door to door, but there is also improvisational theater. We've had national societies mobilize volunteers to do that. We do town criers and speaker trucks, going through marketplaces. I think one of the most important things that we do is we engage at the beginning of any social mobilization campaign. We engage with community leaders, the religious leaders, the village chiefs. We get them on board, provide them with information, and then they help to spread the information among their communities, giving credence and kind of weight behind the message that the volunteers are providing, and letting people know that, hey, this has been already approved by this leader in your community, so it's a legitimate message. So that's something we still very much do this day. And I believe you had a second part of that question, but I'm forgetting what that was.
One was social mobilization, and the other was Vaccinate a Village.
Oh yes, Vaccinate a Village. Yes. So Vaccinate a Village is very much still active. I'm thinking of the figures. I typically get about 30 to 40 Red Cross clubs that contact me each year with interest of doing Vaccinate a Village. We have resources online on both redcross.org/youth. There's an activity guide which provides clubs with everything they need as far as how to set up the program. It provides the cutouts and everything else, and then information on how to remit funds back to the International Services Department so that they are received to our programs. As part of Vaccinate a Village, one of the things we do provide free of charge to all chapters is lapel pins. I'm wearing one right now. We encourage clubs to sell these for about $1 a piece. Symbolically, this is the same exact cost it costs to vaccinate a child in a low-income country with a single measles vaccine. So $1 covers the production of the vaccine, the cold chain used to transport it, the materials, so the syringes, the burn boxes, and the healthcare worker to administer it. So it's $1 for all of that, and it provides lifelong protection. So it's actually one of the best return on investments for as far as health interventions globally. So if anyone's interested in Vaccinate a Village, again, contact me at measles@redcross.org, and I'm happy to provide information or other resources on it.
Would you also put down the Measles Rubella website so that people have access to that, because that has a wealth of resources. And one more thing I wanted to say, when I was in the olden days when we used to raise money with the pins and stuff, I went to a school in our region, in Central Coast region, and talked about the measles. And I brought in a Coca-Cola bottle. Excuse me for using Coca-Cola, it's no branding. But I brought in a Coca-Cola bottle and a candy bar. And I said, for the price of a Coca-Cola or a candy bar, you can save a child's life, under $1. And at the end of the assembly that I was doing, there were 500 kids there. We had raised $750. We didn't ask for it, but kids started passing around a bag, And they came and gave that as a gift to us at the end of the talk. I'll never forget that. It was like, youth are the ones that, because it's so credible, because they have friends the same age that could have died from the measles, but had they lived not lived in the United States. So I just love the fact that you're coming, that Vaccinator Village still exists. And thank you for putting that in the chat, James. Anybody else will have any last minute comments? We're winding down to the last minute. Feel free. I will stay on later if people have more questions. We'll also send a follow-up email with any resources that James or any one of you on the panel want to share with the people that attended today. And there'll be a whole bunch of people that didn't attend that will have the recording available to them next week. So I'm so grateful to all of you for your participation. And for me, it's so exciting that it feels like the measles has not stopped being educated about, at least in our region. And James, at the national level, thank you so much for all the work you do. Anybody last minute-y? I'm way too long talking. Anybody last minute-y want to say anything? Somebody just said in the chat.
Just want to say thank you again for this opportunity. And I just want to say how amazing Neha and Annalicia and everybody at the Northern California Coastal Regional has been. You guys are just a phenomenal team. And I really appreciate everything you guys have done. And just to mention, I put in a link to the Vaccinated Village activity guide. If anyone is interested, that's available there.
Yeah, and somebody just put in the chat that they wanted to have literature. If you look on the website that James put in the chat, you'll be able to see literature and resource guides, not just for youth, but for public in general. So I thought that would be useful to you to answer your question. And by the way, dear panelists, there are lots of thank yous in the chat. Blessings and thank yous for your times and answers. Thank you for the opportunities. Have a great day, everyone. Good information. Thank you all. I'm so excited. Thank you. Thank you, thank you, thank you. Have a wonderful, wonderful day and a great weekend, you guys.
Thanks, everyone. Bye.
Bye, everyone.
Thank you.
Bye-bye to you all.
Bye-bye.
Goodbye, everyone.
Goodbye, and thank you so much for being on the